Hello and welcome back to our channel where we are talking about technology and how it is rewriting the rules of healthcare. Today's topic, a topic that dreads a healthcare provider but still they can't escape: electronic health records. While electronic health records are there to simplify our lives, to connect and deliver more healthcare driven practices in a more efficient and effective manner, still somewhere down the line the compassionate healthcare feels diluted under the burden of electronic healthcare records. So here's the big question: can AI help us deliver a more smarter, efficient, more effective and compassionate healthcare? And to discuss this, we have with us Dr. Gautam, who is an experienced AI healthcare professional, and since last 20 years she's been redefining the rules in the electronic health records, and of course working on a platform called Humeta that is there to support the healthcare institutions when it comes to electronic health records. Welcome, Dr. Uma. Thank you so much for joining us today. So the first question that I like to throw at you is, electronic health records, we still feel, dreaded, and it still somewhere down the line dilutes. We are not that connected because we are more focused, especially in a hospital setup. I have worked in a hospital setup, so I know what importance these electronic health records play. But we still feel that, we still take it as a burden. So what is still holding us back, even if we are in 2025, AI driven, up there, all talking about it, still something is holding us back. So just take us through, what is holding us back?
Sure. Thanks first of all for having me on this conversation. And I think, when we talk about electronic health records, especially in an institution where there is, as I said, multi-modular approach, first kind of a point that holds everybody back is a lack of interoperability.
Right.
You may have multiple modules or multiple vendors who have had their contribution in running your operations. So for example, a hospital might have admin module supplied by someone else. They may use a laboratory, maybe in-house or outside. They may be using another software, for example. Now we need something to compile all of them and give it to you in one screen, for example. That would be an ideal situation, isn't it? For a doctor, it will be a dream come true. Now, that is lacking for many known reasons as of today. Wherever we talk about, globally, that's a problem. There are some countries who have conquered to a large extent to overcome this problem, and a large part of their health data, key health data, is available under one platform, for example. But we have not yet reached that distance where we are saying that, okay, we have everything, all the key information about my patient under one roof. So lack of interoperability is a pain. So, on a daily basis, you and I know how busy a hospital setting could be. Now, I'm not talking about OPD. I'm not talking about consultation room. That's again an important setup, but you have time to analyze stuff, right? I'm talking about an emergency room, for example. Every second is of crucial value to that life that you are saving or trying to save or trying to help. Now there I can't be, waiting for a result to be posted in the EPR, or, I can't be toggling between screens. So that's, when you step into the shoes of a clinician in a very stressful situation like that, you would understand how important it is to have an integrated system. So lack of interoperability is one. Usability, right? Now, as EHRs have become a thing, once we didn't have any EHR, and then when it became a trend, now everywhere there are EHRs flying around. There is something called click fatigue, right? So to get to a reading or to get to a tab in your overall patient record, you may have to go through a lot of clicks, right? If I want to read, so for example, you have a lab report that has come in, or a radiology report. Now you go to the patient, click on the results window, and then you go by date wise, and then you go to the patient's record, maybe enter your login credentials again, maybe double check the patient's ID, their date of birth again, the diagnosis, and then because those details are very important to be double checked. Talk about prescribing a medicine. You have to go through all of the essential checks, because as a healthcare provider you can't take chance. You have to be very, very sure. Click fatigue is a very, very common issue in many big scale EHRs, where you have to navigate your way through in your portal, for example. And last thing, I mean, among the a lot of issues, I think the key ones, and the last one is a lack of standardization. When you talk about as many regions and countries we have that many types of EHRs, the way of presenting data. Today we have languages like HL7, HIPAA, FHIR standards, etc. But how many of the EHRs are compatible or even come into the umbrella of being compliant to those standards, right? So that's another problem. And I think because of these key issues, today when you go to a healthcare provider and say, why don't you have an EHR in your hospital or your clinic, they would say that I haven't heard good stories about people using it. So we have to, when you talk about these, I think what we need to do is, known issues can be addressed in a more structured way than having like a surprise bug coming in here and there. So that's, I think, is key to why people are still facing problems using systems like EHRs, because there are many, and so much has to be done to get them all in one frame, I guess.
So Dr. Uma, imagine if these electronic health records talk back to the clinicians. How close are we into turning these electronic health records to real-time co-pilots for the practicing clinicians or healthcare providers?
Yeah, so as we discussed, the busy environments in the hospital or even a clinic, something like, when the patient walks in, for example, if you use an ambulance service, when a patient is being picked up, I'm talking about, when you said that, if the systems could talk back, what it would look like. When a patient is picked up in an ambulance, the technician feeds in the vital signs, and you have the artificial intelligence telling you what the symptoms are and what could be the possible treatment lines and what you need ready in your clinic. Somehow it's all plugging and playing, and you are getting an automated workflow, for example. When we talk about making it easy for a clinician, we always have to look at them as workflows, an end-to-end workflow, because today when we are talking about the pain points, one of the main things is that talking in silos. We're not connecting the dots, right? So an ambulance comes in, you already have data about the patient, you already have analysis about, if they were your usual patient, you have their history, everything there, your ER notes pre-populated in front of you with all the usual stuff that you would otherwise enter, and you have instructions about, or hints or suggestions about what you need to have available with you at that time to cater to the patient in the most appropriate way. And then when they are given the care that they are here for, and then you move them to the ward, and you have everything collated in one screen or one little app or one little application, for example. That is what I think automation should be, or artificial intelligence should be in a clinician's life, because then they will have more clinical time to spend with the patient, to connect with your patient, to understand where they are coming from, whether it's an emergency or a non-emergency, right? You have to connect. There is that lack of empathy that we are talking about today might be mitigated.
Yeah, like you said, the doctor or the healthcare provider will be able to read more in between the lines, and as you also mentioned, the non-verbal cues that are more connecting and that speak much louder than the verbal cues. So the healthcare providers will be able to focus much better there.
Because when you connect with your patients, you build trust, and in today's world where we are talking about this overwhelming amounts of information that's flowing around, when you talk to your patients and build that trust is when you actually deliver the healthcare that they need and that you need to keep your organization live and developing and progressing and flourishing.
So Dr. Uma, you mentioned a very interesting term, click fatigue. So I relate to that because I have worked in hospitals wherein we were also asked to plan all the nutrition related things on a system. You need to click on a patient, you need to see the UHID, then you need to see the reports, then you have to see what the condition is, and then you plan the diet in that entire system. So I could relate, I can very much relate to that click fatigue. So do you think the entire documentation or the entire EHI record somewhere down the line, doctors do feel disconnected or they spend more time in documentation than delivering the clinical care, as I would say? If yes, then what are the solutions available and how is Humeta helping flipping this reality?
Yeah, so as we discussed, navigating your way through in an already complex environment in a complex system to get the information you need can be a very hectic task on a daily basis. When it is one-off, you may not feel the pain, but if it becomes your way of working, then you obviously are going to feel more and more stressed to kind of use that system, right? So the solution to that is, going back to our first point, like, having an interoperability compliant environment, or having like a platform where you get all the insights that are needed for you to take that informed decision. So Humeta has been empowered in a way that it learns, it has all the information from your multiple legacy systems if you have in your setting, and drawing insights from those information and giving it to you at the right time. For example, if you are planning your patient education material at the end of the consultation or at the time of discharge, now you know how difficult it is for, as a dietitian, you would know when you are discharging or when you are sending the patient home, you wish you had that ability to click one button and give them all the information that they need, personalized to their needs, right? So for example, all people who are living with diabetes from the age of say 50 to 65 may not be the same. Yes. We are all different. We are all different. Some people who are living with diabetes falling under the age bracket might be on specific medications, yes, which might make adherence to your diet more difficult for them. How wonderful it would be for a tool to give you personalized, tailor-made patient education material at the end of your consultation. This is something Humeta is capable of doing, right? So at the time of discharge, maybe we are not at that space in our journey in using the EHR to consider all the social circumstances in a country specifically where we are talking about. Globally, in other places, it is available and it is actually taken into consideration when you discharge someone home. You take into account how their housing is, how they are living, who they are living with, is it safe, etc., etc., etc. When now those things come into consideration, now you want a global view of that particular person that you are treating, right? Now that is when a solution like Humeta comes into place, because it knows from the electronic health records where my factors are that I need to keep in mind when I'm planning a care plan or a therapy, or even say for example an educational material for this kind of a person or a family. In some cases family education is also equally important.
It's so important.
Example, a child with a learning disability, right? When their parents are empowered and educated, they are able to cope with living with that child and empowering that child further more easier. So that's one example. Or a person who has suffered stroke, and they are not able to move as they were before they suffered that injury. Now their family needs to understand, where they are coming from. Cancer, another chapter that we need to be very sensitive about. There are multiple elements to it. There is a mental health element, there's a physical health element, and there is a lot of lifestyle related information that you may want to give your patient at that point in time to make sure that they are informed enough. When you inform them, when you empower them, is when they trust you and connect to you more efficiently.
So Dr. Ruma, I also recall one of the experiences. So as an ICU dietitian, when I used to practice in a CCU setup, so most of the times there are a lot of anticoagulants and list of medicines that is included in doctor's line of treatment. That ICU sheet is just filled. And you don't have space also to write sometimes the nutrition recommendations there. So that is the level of care that is given in a crucial setup of CCU. So once the patient is discharging, you need to counsel them on the drug nutrient interactions, on the anticoagulant nutrient interactions. You need to counsel at a family level, how you cook, how you prepare, how you pre-prepare the food. We go to that level of counseling, because most of the times or sometimes the person gets discharged from that clinical setup itself. They don't go to the room or something. If the doctor deems fit, they discharge it. So how do you think this whole Humeta thing can automate or automate the clinical workflow? Can that happen? Is it too good to be true, or that is actually possible?
Oh no, it's not too good to be true. So to say, because we are talking about driving insights from as you mentioned, ocean of information. We are drowning in information but lacking insights. Now if I have I might have rows and rows and rows of records with me. If I don't know how to use them to A, boost my business, or B, get more engagement from my clinicians or my patients, it's of no use. Or in a positive way, if I need to put it, you can make good use of your information if you have the correct tools there sitting to advise you on the right actionable insights. So when you mentioned about considering the overall circumstances and considering family as a unit or the person as part of a much bigger unit, starting with the family level, is when Humeta can play a key role, because as I said, it's going towards the personalization of the information that is given. And if we step further in that direction, now personalized medicine is becoming more and more relatable and more in action or trend in many parts of the world, and where, as I mentioned in previously, that considering them as part of the unit becomes more important and key aspect of their decision making than the person himself or herself. Now when you talk about personalized medicine is when you want a tool that is sitting there drawing insights from various parts of the system to say, okay, has this person been treated with this medicine before? If yes, were there any side effects? Or when there were side effects, if there were, what did they do to counter effect, right? Now you or someone who might take your position at a later stage might not have that intuition or the time to plow through all that records to give you that insight. Now this is in the clinician's level. If we go on an organizational level, decision making about the overall business, the cost, where is my cost going? If I have two surgeons doing the same number of surgeries in my theater, why is one giving me more cost heavy statistics than the other? See, these are insights that you would draw from the same set of information. It's just that you need the right tool like Humeta to give you that hint. And we always mention them as actionable insights because I don't want to give you a pie chart and say, here you go, that's an insight. It's not an insight unless and until you tell me you tell me what I need to do out of these statistics. Yes, I have a pie chart which shows 5 sections, 5 different colors, 5 percentages. What are these? How do I implement that in my everyday operation? If you are owning and running an institution or a healthcare provision setting, that kind of gives you information to make decisions based on the trends.
So Dr. Uma, let's talk results quickly. What happens when an AI is embedded into an EHR? Can you share a story or a moment where this plug and play saved time, effort, and maybe saved a life?
Yeah, so in the example that I gave you of the ambulance, and that's something that is an evidence to how AI can improve the efficiency. When we talk about saving time and effort, we are talking about improving efficiency and performance. Now when you embed an AI into your EHR ecosystem, I say ecosystem because I'm saying multiple legacy systems talking to the EHR in one or the other way, and drawing back on our conversations about actionable insights. Now that is both clinical and operational, right? So we know of a situation where the ambulance brought a patient who was suffering cardiac arrest. Now we talk about predicting the other things that the patient might be at risk of. Say for example thrombosis, right? Now deep vein thrombosis is a very serious condition that can be fatal if it is not attended to at the right time. Indications like deep vein thrombosis or marking patients at risk of DVT when they come with certain symptoms and signs has actually saved lives. When the emergency room physicians know that this particular person is at risk of developing DVT, they have administered anticoagulants or having prophylactic medicines ready in place. That has actually saved lives, and statistically this has been proven in terms of predicting. And again, another key area where AI has saved lives is sepsis. Giving indications to treating team about patients at risk of sepsis is a big, a boon for not just clinical outcomes. Improving clinical outcomes is yes a key benefit, but also operationally you are having better indicators, better KPIs, and obviously when you perform like that, you are going to have the trust building on its own, and I think your work will talk more effectively than you having to go and talk about your work. So that's because it is key, and what we are doing here is just we are drawing from the information you already have and converting it into insights that you can put to good use and implement in your everyday workflows.
So Dr. Uma, if you have 60 seconds to pitch the future of healthcare AI, what would it sound like?
Yeah, so we are not into AI as a future. We are already in AI,
right,
to be very honest. So in my view, it is going to be, so for example, I will just give it to you in a scenario. So a diabetic person misses a prescription refill.
Yes.
The system detects an issue with their adherence, sees a spike in their blood glucose level, goes back to the last 3 readings, detects that they have not taken the refill, and it raises a call and alerts the clinician to call them, or alerts the pharmacist to call the patient and remind them. Now, how wonderful that would be as an automated workflow. There's no thinking, no interpreting. An intelligent tool doing these for you in the most personalized way, and that's where healthcare with AI and empowered by Humeta is leading.
What a conversation, from buried paperwork to actually actionable insights and what can be done. And thank you, Dr. Uma, for letting us know what happens when tech meets purpose, and that AI is no longer optional. It is what we are living in. If something sparked in this episode, don't hesitate to reach out to us. And I'll see you in another episode with another conversation on tech in healthcare. Thank you so much for watching.